In today's video, I will be discussing the factors of progression you will need to know to get the most out of your ELDOA practice to overcome pain and restore function. My name is Carolyn Zeff, and I'm an athletic therapist and osteopathic manual practitioner. The ELDOA postures created by Guy Voyer have many different positions. Each are designed to target a specific joint in the spine or in the body. You may go through a learning curve while trying these ELDOA postures, so please take your time and be patient with yourself. ELDOAs are a great vehicle to use to help you to become more mindful of your body and the space it occupies. As you get into trying the ELDOA postures, pay attention to your form, your breath, and your intention. These elements will help to improve the overall outcome of the ELDOAs performed. Some essential points you need to know before you perform an ELDOA are: make sure you are well hydrated. Dehydration can affect the sliding and gliding movement of the fascial sheaths between the skin, muscle, and bone, making these layers less compliant. If you are dehydrated and stretch deeply into an ELDOA posture, you can risk injuring yourself. So make sure you are hydrated. 8 glasses of water each day is a good average to strive for, though your hydration requirements may differ. Do a warm-up before starting into the ELDOA postures. Make sure to include some ankle, knee, pelvis, torso, neck joint circles, as well as a few balancing postures like standing on one foot to stimulate the osteoarticular proprioceptors. As you perform the ELDOA, move in and out of the ELDOA posture slowly. While in the ELDOA posture, slowly but progressively increase the tension on the connective tissue by actively using the muscular system throughout the arms, legs, hands, feet, head, pelvis, and spine to maintain a global tension from the tips of your toes and fingers to the crown of your head. Keep your eyes open, looking downwards or slightly in front of you during the posture. While holding the ELDOA posture, continually maintain a long traction or axial extension of the spine. Creating axial extension in the spine means you are reducing or flattening the curves in the cervical, thoracic, and lumbar spine through active muscle contractions with the intention to create elongation. Make sure to focus on your breathing throughout holding the ELDOA. Your lips should be closed and your jaw relaxed, so the teeth are not touching. Silently breathe in and out through the nose as you maintain your tongue on the roof of your mouth to create a good seal. As you breathe in through the nose, focus the breath into the abdomen, fill the belly with air, and think about actively stretching a bit more into the ELDOA posture you are holding. Then as you breathe out through the nose, actively stretch again into the position. Start slowly by holding the ELDOA for about 10 to 15 seconds, then progress towards holding the posture for 60 seconds. To prevent a rebound effect in your tissues, release the ELDOA posture gently, one limb at a time, starting with the arms and the legs, then release the axial extension in your spine, followed by releasing your eye position. Please rewatch this video a few times if you have any questions. In my next video, I will be demonstrating the ELDOA postures for your neck to reduce tension and pain and stiff muscles and improve overall function in the cervical spine. Stay safe, and I look forward to seeing you in my next video.